Dr. Eric Kelly III and a host of phenomenal speakers from all around the globe for this 7-day virtual event that you don't want to miss.
The mission of the Black Business Expo is to raise scholarship money from kids all the way from high school all the way from college. The Black Business Olympics is one of the largest Black business showcases in the world. It is an opportunity for businesses and companies to showcase their businesses globally. We are going to be giving away laptops up to $5,000 away to students. Again, I'm Olivia Appleberry, the founder of 2 Cents Finance and one of the speakers for the expo. I am so excited to see you there. For more info, go to www.blackbusinessexpousa.com or call 919-308-9090 and hope to see you there.
I am Black business. From the moment I wake until the time I sleep. Yes, I am Black business. I am Black business. Tell me, are you Black business? I am Black business. Do you support Black businesses? Listen, I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black business in the world. The world! Sign up today at www.blackbusinessexpousa.com or call 919-308-9090. I am Black business.
I am Black business. From the moment I wake until the time I sleep, I am Black business. I am Black business. Are you Black business? I am Black business. Do you support Black businesses? I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black America in North Carolina. Sign up today at www.blackbusinessexpousa.com or call 919-380-9090. I am Black business. I am Black business. From the moment I wake until the time I sleep, I am Black business. I am Black business. Are you Black business? I am Black business. Do you support Black businesses? I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black America in North Carolina. Sign up today at www.blackbusinessexpousa.com or call 919-380-9090. I am Black business. I am Black business. From the moment I wake until the time I sleep, I am Black business. I am Black business. Are you Black business? I am Black business. Do you support Black businesses? I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black America in North Carolina. Sign up today at www.blackbusinessexpousa.com or call 919-380-9090. I am Black business.
Dr. Eric Kelly III and a host of phenomenal speakers from all around the globe for this 7-day virtual event that you don't want to miss.
The mission of the Black Business Expo is to raise scholarship money from kids all the way from high school, all the way from college. The Black Business Olympics is one of the largest Black business showcases in the world. It is an opportunity for businesses and companies to showcase their businesses globally. We are going to be giving away laptops up to $5,000 away to students. Again, I'm Olivia Appleberry, the founder of 2 Cents Finance and one of the speakers for the expo. I am so excited to see you there. For more info, go to www.blackbusinessexpousa.com or call 919-308-9090 and hope to see you there.
I am Black business. From the moment I wake until the time I sleep. Yes, I am Black business. I am Black business. Tell me, are you Black business? I am Black business. Do you support Black businesses? Listen, I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black business in the world.
New business owners, entrepreneurs, thought leaders, and corporations, welcome to the Black Business Network. My name is Kimberly Williams, and I am your business moderator for this afternoon on the Black Business Network. The Black Business Network is a 24-hour business network showcasing Black businesses, business owners, entrepreneurs, and thought leaders worldwide. We have speakers from North Carolina, London, Singapore, Africa, Japan, and cities all over the United States. The Black Business Network is a global community sharing its business knowledge to empower, inspire, and educate businesses about business. We have a speaker coming up that's going to be talking about what is small data and why is it important in healthcare. So our next speaker is Tanasia Gonzalez of Effective Information Management Systems. So Ms. Gonzalez, aka T, has amassed over 20 years of experience in healthcare management in several areas, including IT project management, informatics reporting and analysis, financial planning, information systems, regulatory affairs, and continuous quality improvement. She has a successful track record of process improvement through development, implementation, and maintenance of over 30 systems with an emphasis on strategically designing and implementing solutions. I present to you T. Gonzalez.
Hi, Kimberly. Thank you so much for that wonderful introduction. And I am so happy I get to talk to you and say thank you so much for your talk. I thoroughly enjoyed that. And so much of it resonates so deeply with me, as my grandmother was from South Carolina and she had a pecan tree in front of her house that was quite stubborn and would not come up a pecan if you shook it all day. But thank you so much. Yeah, I mean, so I too have my ultimate mentor, my mother, who passed away, who was also in healthcare, a successful healthcare executive who taught me how to be an executive in the healthcare space. So thank you so much for your talk. It resonated.
You're very welcome, and I look forward to hearing you. Genius is common, and I will see you on the other side.
Thank you so much. So I just want to say thank you so much to the entire team for inviting me to speak on the Black Business Olympics today. I'm very honored. Um, I love talking about data. I could talk about data all day long, especially small data. And I'll be talking to you about small data, primarily what is it and why is it important? And what I've learned over the years is that small data does have a place and it has power within many different industries. But I will be focusing on healthcare because I've actually seen the power of small data within healthcare. And what resonates for me there is that we could really leverage the power of small data to change lives. And that's really where the power is. So again, I'm Tanazia Gonzalez, but I do go by T. And I am the CEO of Effective Information Management Assistance, Inc., or EMA for short, EIMA. So EMA is a boutique information management services company specializing in healthcare data, especially small data and small data tools and processes. And I'll get into what that means in a bit. But the firm is a New York State minority-owned women business enterprise established in 2016, and also an MWB BE of New York City as of 2019. What does that mean? We have exposure and access to government grants as a minority owned business by a woman. So it gives us certain um, benefits and exposure to where we would otherwise not have. So it's a great way to get exposure for your business as a minority owned business. And our tagline is we offer expertise that goes beyond technology. Now, what does that mean? That means that my team has over 60 combined years of experience in healthcare data, health IT project management, quality improvement, and a number of other areas. And at the heart of many of these areas is data. So, the main objective of my talk today is really I want to define what small data is, and why it's important. Because it's quite powerful when you can lean into it and embrace it. And I want to provide an overview of the role of data analytics. So, the action you take with small data. And then I'll speak to a few examples of where I've been able to make a positive and powerful impact within healthcare using small data coupled with data analytics. But first, let's talk about this four-letter word that's been so beautiful for me within my life, and I'm so powerful and passionate, and I'm really grateful for the opportunity to really lean into my passion for data, because not only am I a healthcare executive, I'm also a storyteller, as Kimberly was alluding to earlier. I tell stories not only as a playwright, but also as a data executive. And data, the word, is actually the plural of the word datum, D-A-T-U-M, which is a Latin noun meaning something given. So data are individual facts or small pieces of information. In healthcare, these small pieces of information can be created in a number of ways. Within medical claims, these are the services that our providers are giving to patients, and patients go to hospitals and clinics. Pharmacy data, you pick up your medication, are you taking your medication? Different actions create these data, get collected, as well as services. What visits are you keeping with your physicians? What kind of physicians are you seeing? How is it being built? And where is it stored? Primarily in medical record systems, at the hospital space and the clinical space, and many different types of systems. We also have surveys out there that are given to patients that collect information on your experience with the healthcare system and your providers. Are you happy with your therapies that you're receiving and the services that you're providing? So we collect data that way. We also have other venues like health information exchanges, which are, I believe, just phenomenal. And being able to collect data from several different healthcare organizations, pull it into one platform for a provider to be able to see where his patient or his or her patient has been seen within a certain period of time, and give you the benefit of seeing the whole patient and the whole record, so you can treat the whole patient at once more effectively. What types of data am I talking about primarily when I say small data and data in general within healthcare? I'm talking about demographic information, your age, your address, also your diagnoses. What conditions do you have? And your procedures and the cost. What services have you gotten and who gave them to you and how? What medications are you taking? Where did they come from? What do they treat? Are they effective? Your lab values, your vital signs, your height, your weight. Also on the service side in the hospitals, your admissions, your transfers, your discharges, all of these instances have little pieces of data that are created and stored. And the good thing is, with these little small pieces of data, we can take that and answer a lot of questions and also prepare for a better future. We can say, okay, what happened? How did it happen? How do we want this to be better? Okay, it could be better if we do X, Y, Z. Having that data in our hands gives us the power to take those types of actions. So when I say data, what am I talking about? I primarily think of two types of data. We have big data, which I'm sure you've heard of. That's the sexy term. It's very sexy. Big data, it's great. It's great to have. It has its place. But there's also small data. And small data comes from within the big data. Big data is extremely large data sets, that may be analyzed and read with a computer and usually offshore in a cloud somewhere. It's very hard to manage as a human mind. But small data, on the other hand, is small enough for human comprehension. It is data in a volume and format that makes it accessible, informative, and actionable. You can take action with it very quickly. The term big data is about machines, but small data is about people. That's a quote from Rufus Pollock, which I love. I always refer to that quote. I love that because the small data, it's all about diving deep, drilling in, getting to the individual. It's collected with an intended purpose of analysis. So you're collecting small data, you're planning on taking some type of action. And Bison Analytics says small data is powerful analysis minus the big data headaches. Big data usually comes with big price tags, okay? So in terms of the data condition of the two types of data, big data, it's always big and unstructured, like big, clumsy, big thing. Important to have it because we're collecting it through all the claims, all the prescriptions, all the services. We need to have it. That's great. It's sitting there. That's wonderful. But now what? Small data is ready for analysis. It's ready for us to dive into it. It's in smaller tables, it's data that we can work with and comprehend. In terms of the location, as I said, big data is usually in a cloud. It's offshore. It's a big SQL server, hard to reach. You can't quickly dive in there and grab it. But small data is usually kept in small data tools, what I refer to as small data tools, customized databases on a local PC. It's easy to work with and access and take action with. And usually the purpose for both of the sets, big data, has no intended purpose except for collecting it and having it there. Great to have, but small data, that's intended for a specific purpose. We're collecting it because we're planning on taking some kind of action with it. And I know, speaking to all the data geeks, I'm a self-proclaimed data geek. I know that's a horrible name, but we love working with data. We are very curious folks. We love answering those questions that pop up in our heads. We jump in, we extract data, we create reports, really dive in and answer questions. It really satisfies the curiosity. And I get really passionate about talking about small data and creating these different tools because it helps us answer questions, it helps us reach the goal and succeed. And what's the action that we're taking when we're diving into the big data to get to the small data? We're taking an action that involves data analytics. Now, what is data analytics? That's the process of examining data sets in order to draw conclusions about the information within, increasingly with the aid of specialized systems and software, small data tools, SQL, different tools, which I'll get to in a moment. And with the purpose of decision support, tracking and monitoring, and taking some action. So with data analytics, there are 4 types of analytics that are important to understand and know about. We have descriptive, we have predictive, we have diagnostic, and then we have prescriptive. Let me say that again. Descriptive analytics, predictive analytics, diagnostic analytics, and then prescriptive analytics. A little bit about what each is. So descriptive analytics, that tells me what has happened, what is happening. So that's the data coming in, telling me what's actually going on, what is happening right now. You work based on incoming data, and for mining of you deploy analytics and come up with a descriptive based on the data. Tells you what's currently happening. Predictive analytics is what could happen. It ensures that the path is predicted for a future course of action. Pretty cool, right? Let's get better. Let's get ready for a better tomorrow. Diagnostic analytics. Why did that happen? Not only what has happened and what is happening and what could happen, but tell me why. And prescriptive analytics is tell me the best course of action, given what did happen, what could happen, and why did it happen. Really powerful when we're talking about managing populations of human beings. I've worked with groups in the past, with certain conditions, for instance, HIV/AIDS group, just diving into these different types of analytics pathways and really designing tools to better manage the populations and improve lives. Just some powerful stuff when you start diving into the data and leaning into data analytics. And that is what Emma does. Of course, with each engagement, we have to be aware and always cognizant of the people, the processes, and the technology that's involved. Anyone working in data analytics knows this has to be kept in mind. In terms of the people, who are the folks working on the data and in the data? Usually data analysts, data engineers, data scientists. And we have some emerging roles happening nowadays. Chief Analytics Officer is one role that's coming about. And one of my favorites is the Chief Data Officer. And these folks are in place because there is a growing appreciation for data as a separate entity. It's not IT, it's data. It's separate. It needs to have its own space where it's clearly defined and governed. So pretty cool. So that's what I'm talking about in terms of the people. Now, the processes that we follow. For those folks that are managing the data, what exactly are they doing? The key processes are data extraction, you're extracting data from the various systems, your data mining, you have the different programming going on, even with small data, and then analysis and reporting. You have database administration and management, and software development. Great stuff. In terms of technology, what technology is used out there by folks working with data, small data and big data. Like I said before in healthcare, not a lot of times, but most of the time there is a system within the healthcare organization that's designed to house the data that's being created by the visits and the patients coming into the facility. Those are electronic medical record systems. There are some big ones out there you probably heard of, like Epic, Athena Health, different EMRs out there. And having those EMRs, it's great. They are very transactional, but once they're there, they're collecting all the data, and we're able to use and lean into those systems to extract the data and really create some small data tools to get a leg up on specific quality improvement metrics and metric improvement, to really dive into the small data and get really specific on the actions we need to take in order to improve performance on our key performance metrics and indicators. And Largely, there are relational databases used within healthcare data analytics space, and not last but not least is Microsoft Office Excel Access, which is a favorite of mine because a lot of organizations I've worked with really don't have the means to get or have large big data tools that will allow them anything heavier than that. But you can create some really powerful tools and processes to get you to that endpoint with Microsoft Office Excel Access, combination of the two. Why do I always talk about this diving deep and really combing through the big data and getting to the small data, especially when we're talking about healthcare and trying to improve key performance metrics on managing certain populations and trying to meet the performance targets for managing different populations in healthcare? It's because we can't boil the ocean. So being able to leverage your small data allows you to dive into your big data, get really specific about, as long as you know what metrics you need to keep a pulse on, keep an eye on those key metrics, you know the what. Doing that will allow you to see the performance and dive in and see who's contributing to the performance of those metrics, whether it's good or needs improvement, and how, meaning what interventions do you need to employ in order to improve the performance on these particular measures. So with that, I'll just talk very briefly to one experience I had in my past life. As a healthcare executive, just to give you a clear example of what I'm talking about in terms of using small data to drive performance. So there was a Medicaid reform program within New York State, and we had the key mission of reducing avoidable hospital stay because that costs New York a lot of money. So a lot of organizations came together to tackle this one metric. So that's the what. We keep an eye on the what. And now we can see the performance of that one measure, and we can see, are we where we need to be? Are we below? Are we right there? And what do we need to do to get to the destination point? So we dove into the metric to really understand who was contributing to these high rates of avoidable stays at these hospitals, and we could identify certain populations. So we dove into the big data coming through the claims data and the electronic medical record systems, and really could target those patients and those visits and those diagnoses that were really contributing to performance issues with this key metric. And we came up with clear interventions that would tackle this one metric. And we, apply some quality improvement methodologies. Some of you may be aware of Plan, Do, Study, Act, or the Model for Improvement by the IHI, or the Institute for Healthcare Improvement. We followed that, and we applied our small data tools and actions to this one project and actually decreased the hospital use by 19% in 5 years, just by diving into the small data and really taking action. So when I say small data, I'm really talking about diving into the big data, really identifying who you need to focus on and taking action and tracking over time. And that's really the secret sauce of really getting to your goal when you need to follow key performance indicators, whether it's for value-based purchasing or for some other incentive programs that are offered by health insurance plans nowadays. That's pretty much the secret sauce that we follow. And Emma can definitely help get you there. If you need some key tips on how to do that, please reach out. This is something we love to do. We love diving into the data. Let's see, another example of when we were able to identify or keep track on the what, identify who's contributing, and then apply the how, what interventions we need to apply, is when I was involved with the HIV/AIDS Care Center. So there are several key performance indicators that are evidence-based, handed down by the state. These evidence-based key performance indicators are there because they're proven to work for this population to help get them healthy and keep them healthy. And I always tell everyone, I am in awe of what these doctors have done to turn this condition into what it is today. I'm so very grateful to have the opportunity to work with them and to be there providing these small data tools to help them track how they were doing on their key performance indicators and identify those patients that they needed to get back into the clinic so that they can stay retained, so that we can make sure they're taking their medications, so that we can make sure that their viral loads are at a good level and they're not slipping, and that the patients were thoroughly satisfied. In awe of what these doctors do, and I'm so grateful to be able to work with them and all of the clinical professionals that I work with in healthcare. And I'm grateful that I'm able to provide my passion and service to them by way of data and data analytics and small data. I'm so grateful, in fact, that I'm so passionate about this small data thing. I actually have a podcast out there called Let's Talk Small Data with T. Go over to my website, eima-inc.com, and you can click on the tab, Let's Talk Small Data with T, and check it out. It's actually had 10,000 reaches so far since its inception in 2021. We've been listened to over 6 continents and over 36 countries. And I've interviewed folks in Kenya, in England, in Vietnam, and many different places across the globe. Of course, places in North America, Oregon, different areas, Chicago. And folks are really excited about this small data thing because it's a powerful tool to be able to dive into your small data to really get to your goals. Stay at and get to your goals and stay there. So it's all about keeping track of your key measures and diving in to make sure you know who's contributing and how you can improve the performance. And there's the power in small data. Kimberly, that is the end of my talking points that I have. I wish I could see folks who, if you have any questions, please reach out to me at tgonzalez@eima-inc.com. Dr. Hood.
Hey, thank you so much.
Hello, thank you.
Thank you. We love you being here.
I love being here. I'm so grateful for the opportunity to come and speak to folks about this small data thing, which I find very, very interesting and fun. And
absolutely.
And yeah, so thank you
This
and
is
the whole
wonderful.
team.
Thank you so much. And look, Genius